Today, we're going to pull back the curtain on a crisis that's unfolding deep inside the UK's National Health Service. And, this goes way beyond the headlines we all see about waiting lists and budget cuts. We're talking about something much more fundamental. So let's get right into it.
I want you to start with this number, 100,000. That is the staggering number of jobs sitting empty across the NHS right now. But look, this isn't just a staffing problem. This number, it's a fever. It's a symptom of a much, much deeper disease in the system. And it's putting both patients and the staff who care for them in serious danger. So, to really understand what's happening, you have to start with the people. We have to look at the incredible human cost that this crisis is having on the very workforce that keeps the NHS on its feet.
Think about it. Those 100,000 empty posts create this dangerous domino effect. The staff who are left are just stretched to their absolute breaking point. We're seeing 41% report being unwell from work-related stress. Over half, 56%, admit they're coming into work even when they're sick, and 2/3 of nurses are working way too many hours. This isn't just burnout. This is a recipe for disaster. It's how medical errors happen.
But we need to be really clear here. What's happening to staff is so much more than just burnout. There's a term for it, moral injury. Just imagine for a second. You're a doctor or a nurse. You swore an oath to provide the best possible care. But the system, because of its constraints, forces you to do things you know are wrong, like discharging a patient too early just to free up a bed. Having to make those compromises day in and day out against your own ethical code, it causes this profound psychological damage. It's what happens when you put good people inside a broken system.
So the big question is, how on earth did we get to this point? Well, this human cost is no accident. It is the direct result of a total breakdown in how the entire system is governed, a crisis of accountability.
The whole story can really be told through two key laws. First, the 2012 Act. It basically shattered the NHS into hundreds of little local pieces, and crucially, it changed the government's fundamental responsibility. Then, the 2022 Act was supposed to be the fix, right? It was designed to give the government powerful new tools to step in when things were going wrong. But, and this is a big but, there was a catch.
And here it is. This is the absolute heart of the problem. Before 2012, the law said the Secretary of State had a duty to provide or secure health care for everybody. After 2012, that legal duty got watered down to just promote a health service. Now, that might sound like a tiny, insignificant wording change, but it created a massive accountability vacuum. It basically let the government off the hook for any direct failures in care.
And that brings us to the core diagnosis of the problem. The 2022 Act gave the government these incredible powers. We're talking about sections 14Z61 and 45 to step in and fix failing parts of the NHS. The problem? They are flat out refusing to use them. They're treated like these nuclear options that are just too scary to touch, so they sit there gathering dust while the system crumbles around them. The tools are right there in the toolbox, but nobody is willing to pick them up. Okay, so if a lack of accountability is how this is all happening, the why is even more disturbing. It turns out there are powerful financial incentives that are hardwired into the NHS. Incentives that actually, and I mean literally, reward the denial of care. Just look at some of these mechanisms, it's wild. A GP can get paid a £20 fee specifically for not referring a patient to a specialist. GP practices are given financial rewards for deprescribing. That means cutting a patient's medication to save money, sometimes without any clinical reason. And then you have block contracts, where a hospital gets a fixed pot of money. Once that money's gone, every patient they treat actually costs them, creating a massive incentive to delay or even deny care. And who gets trapped in the middle of all this? The frontline clinicians, of course. They become what the source material calls a risk-absorbing membrane. The system itself creates all this risk through understaffing and these perverse financial targets. But it's the individual doctor or nurse who's left holding the bag. They're the ones held legally and professionally responsible when a patient inevitably gets hurt.
And here's the ultimate mind-bending paradox. This system, which is supposedly obsessed with saving money, is one of the most wasteful things imaginable. It's burning through over £58 billion on things like failed IT projects and super expensive agency staff. And at the exact same time, it's racking up over £60 billion in future bills for clinical negligence. That's money set aside to pay for the harm this unsafe system is causing. It is costing an absolute fortune to be this dysfunctional.
Okay, so the diagnosis is pretty grim. I get it. But it's not hopeless. In fact, there is a very clear prescription being put forward by patient safety advocates and civil groups on how to fix this. And these solutions are practical. There's things that could be done right now. First, just use the powers that already exist. Make those so-called nuclear options a routine part of regulation. Second, create binding agreements to make sure patients don't get lost in the gaps when they're handed over between different NHS services. And third, and this is huge, create a safety override that legally protects any clinician who puts their foot down and says, no, this is unsafe, even if it means missing some financial target.
And for the longer term, there's a bigger idea on the table, a brand new law called the NHS Accountability and Patient Rights Act, or NAPRA. Honestly, this would be a total game changer. It would bring back that fundamental duty to provide care, it would write minimum safety standards into law, and it would create a powerful new body to actually enforce them. It's about rebuilding the entire system on one simple principle: safety first.
So when you boil it all down, the most crucial point is this. The problem isn't that we don't know what's wrong, and it's not even that we don't have the solutions. The legal tools to enforce safety and accountability are, for the most part, already there. The diagnosis has been made, the prescription has been written. The real question we're all left with is, what is it going to take to get the people in power to finally use them?